I still welcome you for the next session with the oral and poster presentations. Now I welcome any of you who are ready to share the slides and present the topics on oral and poster presentations.
Good morning, Dr. Teddy. My name is Jane and I'll be presenting for the next topic. Can I ask Dr. Erin to share the slides, please?
Sure.
Thank you. Good morning, Dr. Teddy and colleagues. Thank you very much for the opportunity and time given to me. My name is Jane, and today I would like to give a brief presentation on a guide to oral and poster presentation. Slides. So presentation itself, it is the art of delivering a speech. It can be on a one-on-one basis, or it can also be before a group of people. It is a very valuable skill, especially to us as residents, as we are required to present our paper or present our research in scientific meetings, be it in the domestic events or international events. It is a skill that can be developed, meaning it can be taught, learned, and trained by everyone. And it's not just exclusive to those who are naturally confident at public speaking. Next slide, please. So there are 4 P's that will serve as a guide for us to create our presentation, be it oral or poster. And the first P is to plan. Slides, please. So when planning your presentations, there are 3 points to consider. And these are the points. Slides. The first point is you have to analyze your audience. There are questions to consider or that can guide us when we want to analyze our audience. The first question is, who is your audience, or who will your audience be? Are they from the same line of profession, or do they not have any medical backgrounds? Are they from the same set of specialties or different? Which brings us to the next question. What do they know about the subject? Once you know who your audience will be, then you should have a fair knowledge on how much do they know about the subject that you'll be presenting. And the third question is, what do your audiences want to know, and how are you able to engage your audience, and what are the subjects that matter to your audience? Slides. So the second point when we want to plan our presentation is to have a clear purpose or goal. Is your presentation, is the purpose of your presentation, is it to provide information? Is it to persuade your audiences to accept your point of view, or is it to encourage them to take actions? By having this clear purpose and goal, then it will help you to decide what to include and also what not to include in your presentation, and will help you to structure your presentation better. Next. The third point is, please keep in mind to select the effective information. There are 3 questions that you can ask yourself. The first question is, what is the best information to support your presentation or your ideas? What are the informations that are relevant to your audiences? And what are the examples or case studies that will best illustrate your ideas? Next. The second P is to prepare. So this is the recommended framework for presentation. It's a very general, which consists of introduction, body, and conclusion. Whereby in the introduction is where you want to have an overview of your issue, of your background. It's where you want to mention if there are knowledge gaps, your hypothesis, and the aim of your presentation, as well as the key terms. In the body section is where you want to elaborate more on your main ideas. It's where you want to mention the reasoning, the evidences to back up your ideas, and also the explanation behind it. Keep in mind not to overload your audiences with information, and you can do that by categorizing your ideas into key ideas, or later on in the poster you can use some bullets or numberings. And the last part is the conclusion. It's where you sum up all the information, and in here you can also include some take-home messages for the audiences on what you wish your audiences to remember. Please consider, please set a time for each section so that you won't go extend beyond the time limit. Next. Next, please. So the second point in preparing your presentation is to select appropriate visual aids, meaning to have some figures, bar charts, and also smart charts to complement your presentation. But please remember that those visuals are not the presentation, since its purpose is just to enhance what you're trying to say by providing the visual link. Next. So there are a few certain points to remember while we want to create a poster. The first is it should be readable from 3 meters away. So that it's recommended that the size of the text should be no less than size 24. Please keep the text short and draws interest. And the word count should be limited around 300 to 800 words. Your point should be clear, concise, and also to the point. And it should also be easy to read. So like I said before, you can use bullets, numberings, and the layout should be clean. And don't forget to include any affiliations or acknowledgement. Next. This is an example of posters where you can see the poster on the left. The texts are very small, crowded, and long, and I doubt it will be readable from 3 meters away. And like I said, again, the layout is very crowded, so I guess the audiences will have a hard time reading through it and picking up the main ideas. And it doesn't look very attractive and engaging, and most probably your audience would just skip towards the posters that would attract their attention, which brings us to the poster on the right. As you can see on the right, the texts are kept simple, short, and it should be readable from 3 meters away. There are pictures and also graphs to complement the presentation, and it looks interesting and engaging to the readers. Next. So a few points to consider while creating an oral presentation. These are just, again, general. You make sure that the text on your slides are readable by the people in the back row. Make sure that the text is simple and short. And also, you have to keep the graph or images that you included to fit the slides. And please keep free 10% of the slides margin, especially at the bottom, so that you could include some footnotes or citations. Keep in mind also not to use fade transition, bouncing text, or even swooshing noises, as it will cause distraction to your audiences. Next. Again, this is an example of slides that were used in oral presentation. As you can see in the slides on the left, the texts are, again, long, crowded, and the people at the back row will have a hard time reading it and picking up the main ideas. The layout is very boring. There are no figures or bar charts to complement the presentation. Whereas on the right, we can see that the main ideas is structured in a very good manner. They use smart charts to present them, and they also use colors and also interesting backgrounds. Next. So the third P and the last P is to practice and present. Next. So before your presentation, make sure you practice several times again and again. It's best to practice it in front of your teachers or your colleagues so that you can get some feedbacks from them and also some areas to improve. And the second point is also to time your presentation. Make sure it is within the limited or within the given time. If it's too long, try to remove them or simplify the information rather than you trying to speed up your presentation or to rush through your presentations. Also, when you do your presentation, please keep in mind to keep your posture in a correct manner by standing straight and also keeping your feet planted to the ground. Some movements are allowed, but make sure you do it with purpose, since a lot of movements again could cause distraction to your audiences. You may also want to establish a resting place whereby you could place your hands at the front of your body so as to avoid you to fidget unnecessarily. And one of the most important thing to consider while presenting is to maintain eye contact, because it is a very powerful way to engage your audience, and so that your audience would also know that you're confident enough and that the ideas that you're presenting is trustworthy. And last but not least is to speak more articulately, meaning to speak slower and also louder than you normally would. And you can also provide some emphasis through your main ideas through your voice intonation, your volume, and some pausing, especially in between the main ideas, so that it will allow some time for the audiences or the readers to grasp the information that you just conveyed. Next. Thank you. So that will be all, sir.
Okay, thank you very much.
Thank you, sir.
I still get people coming in. Now, welcome to all of you to discuss if you have any. If you don't have any, then we could end the sessions. If you don't have the spirit to know more, to dig more based on what Jane has presented.
Yes, sir. I have a question, sir.
Okay. Welcome, Amer.
Yeah, my apologies before, sir. Before you called my name before I was in the toilet, sir. Very sorry.
No worries.
So, thank you for the presentation, Jane, regarding the oral and poster presentation. I would like to ask maybe regarding the tips about the duration of time for to present our poster, but still engages or attract the judges. How long is too long and how short is too short? And also another question, maybe, do you have any tips or experience regarding oral or poster presentation during this COVID pandemic? Maybe how we make eye contact? Do we see the camera, or we keep us engaged to our slide, or do we move our hand so the judges could see? Maybe that's my question. Thank you.
Interesting questions. Thank you, Almer. Yes, Jane, please.
Yes, sir. Permission to answer, sir. Thank you, Dr. Almer, for the question. For the first question, from what I've read, it's actually, for the time limit, it's different between the events or meetings. I mean, some meetings actually gives the participants around, I mean, for posters around 15 to 20 minutes. But again, it depends on how many posters will be presented. And also for the oral, I think around 15 to 20 minutes. But if you are to ask me how long, I mean, what's the maximum time? I guess if it exceeds more than 20 or 30 minutes, then you might somehow, I mean, some of the audience might actually lose their attention or interest towards your presentation. And for the second question, honestly, I don't have any experience. I mean, I don't have any experience in presenting a poster or oral presentation during the pandemic, because I have not attended any. But it's a very interesting question when you point out the eye contact. I mean, it will be actually quite difficult when we are trying to operate on our slides and also look into the camera. So I guess as long as your eyes are fixated on the screen and not wandering around, or I mean, your eyes can wander a few times, but make sure, I mean, your eyes are fixated on the screen so that the participants or the audiences know that you are trying to engage them and you pay attention to them. That will be my answer, sir. Thank you.
Right, good. So I understand that you tried your best to respond to what Almer asked. The second point might not be, easy to respond, because with this platform, I think because of the distance learning or distance interactions, we could not really get attentions by eye contact, because we may see others in one screen if you put them on a gallery view, but others may not see you. So I would say briefly, this is not based on my own detailed observation, but just very limited experience. You try your best to use all modalities when you perform, when you present based on this platform, through this platform, I mean. One of the important point is in regards of speed. Speed of speaking is very important because others may not get the same good connections on your side and vice versa. And specifically that you can control realizing the quality of your connection when it comes into attention that you are informed your connection is currently poor, then you need to stop for a while, not only slowing down your speed of speaking, but you need to stop for a while until the notification on your screen that your poor connection has subsided, then you may resume your normal speed. I'm trying to give this is an example where I could talk this speed, but because of this platform, I'm slowing down, and quite frequent, I'm trying to use the technique, which is very easy. That is pause. Rather than expressing the non-word sound like many of you see it as normal, if I have to talk about this oral presentations, then I would say, and I would like to, and then it comes into not understandable, okay? So instead of using that non-word sound, you just take pause, like I'm practicing now. Actually, my brain is much faster than what I'm saying, but it would be good if you practice yourself to realize this technique, to control yourself. Rather than, I would say, this is the technique that I would like to tell you. Without I just take pause about the technique of giving would be different with I just take pause. In giving oral presentations, if you think that you are limited with your time, be brief with your speaking, meaning that by given more limitations in terms of time, then you need more preparation. It would be good if you prepare writings. I mean, I would say teleprompter. Teleprompter is a kind like, reading materials for news announcer on televisions where they actually see the camera, but they do not see the camera. Instead, they see the teleprompter in front of them. So they read the news, but the camera pick in a good position, good angle, that it looks like the presenter is seeing you, the viewer, on the other side, on the television screen. In fact, they read the teleprompter. So with this platform, we are given the luxury to prepare ourselves by preparing your teleprompter. So if you know that, the sequence of your slides while you are reading the teleprompter, I just ignore my slides here on my screen using Zoom, as long as I have confirmed that audience see my screen, see my slide, then I would just cover up my my Zoom screen with my teleprompter. It can be in the Word or it can be in the PDF, it depends, but it's different with the slides because the slide may tells you or may tell the audience with some pointers, not sentences, rather than pointers only, but elaborating every pointer would be good if you prepare yourself with your teleprompter. I hope that you understand what I mean with teleprompter. So then you could practice yourself before the real presentation, then you could measure the time you would spend for your presentations. That would be another important, that would be an important point for you when you consider to present using this teleconference platform. Almer, the other armamentarium in taking power of attention from the audience is your clarity with your wordings. Of course, language is an important aspect for you to present. If the presentation should be in English, there is no other way rather than train yourself. Do more and more exercise. If you have free time, then before the timing for you to do the real presentation, you can invite your peers to listen to you and give you feedback when you practice your presentations. All angle in regards of timing, time spent, in regards of the readability of your slide, in regards of the whether your slide is quite catchy or whether your slide give audience proper messages, especially with the key messages rather than providing them with sentences. And the complexity of information in every single slide is also good for you to consider so that you could also take these practice sessions for you for your presentations. Yeah, I understand that the situation is in a huge different poles of on-site presentations, specifically with the oral presentations compared to these presentations via teleconference platform, because you could use more expression, gesture, volume. In fact, all those are really in a big influence of the connectivity. The connections of the internet takes very important role. So if you have all those armamentarium in you with your quality of oral presentations as a good presenter may not be detected properly or viewed properly by your audience through this platform. So this is kind of weakness when you are a good oral presenter in the real physical meeting. So you don't really get the experience where you could take direct feedback when you meeting your audience directly compared to meeting this through thumbnails only, because mostly the screen would be occupied by your slide. Okay, so I think that's my additional points to respond to Almer.
Thank you, Doctor.
Thank you. Any other?
I'd like to ask, Doctor.
Yes, please.
Yes, so since this is an oral and poster presentation, so you need to add more pics. Is there any international guidelines on how we publish patients' pictures? Because I think it's one of the tricks to make our presentation more catchy. And I think it's easier too when we include patients' picture with, it's easier for us to send our perspective to the audience. So is there any international guidelines other than having the informed consent from the patient itself? Thank you.
Very good point, Erin. So I welcome Jane. because you are the master for this session, Jane.
Thank you, Dr. Arian, for the question. In my honest opinion, I have not found the guideline on how to present clinical pictures of patients. But from what we have been taught and what we have learned, if you have obtained informed consent from your patients, or if your patients specify to, I mean, they allowed you to post their pictures, but then they are requested to cover their eyes and also their specific features that might easily be identified to them as their body, then I guess then you should cover those, like the eyes and also some genital parts, whereby it's quite intrusive to the patient. That would be my answer, sir. Thank you.
Thank you, Jane. All right, so there are important points that Jane has mentioned. I would welcome any other to express their own perceptions or understanding. Besides, opinion is also still welcome.
Permission to give some answer, doctor?
Herdy, good.
Yes. From what I know, for the clinical photograph of the clinical patient, there is 3 principles that we can use the patient photograph. The first is for the clinic, second is for the academic, and the third is for the research. So as long as we got the informed consent, and also on behalf of on those 3 principles, we allow to put the pictures of the patient on the poster. But still, we need to make some sensor, or maybe on the face, so the person is not recognized by all. That's what I'm thinking. Thank you.
Thank you, Herdy. Okay, so generally speaking, we follow the ethical rule. So the ethical concept applies as general concept. Besides, you need to get formal consent from the patient. It is not only about eyes and face that could be identified easily by public, but many reputable high-ranked journals ask whatever part of the body they would ask for consent from the patient to allow you to publish their photos. Even this is only about great toe, for example, or about just calf area or back area. But once people could identify, if you're not lucky, let's say an example, you are actually pointing the upper back area, but the patient has specific tattoo on a specific position in the lower back position, while the photo is actually including whole torso of the back of the patient, then the patient would sue you if they recognize that this is their body, his or her body, without consent that he or she released and given to you. So this is just a general ethical conduct about presenting photos. My other concern in regards of presenting patient's picture through this platform is that people in general, public community, as well as scientific community, has to embark into the principle of rewarding others' work. But this is difficult because the culture plays role. Different culture may come with different attitude. So in my own personal technique, if I would like to come into sequence of photos on my presentations, I would show a slide which could be repeated without I read it, but I allows for several seconds for the audience to read my slide that I warned them. I invite the audience to appreciate the photos and videos that have courtesy. So I invite the audience not to take picture and even recording it through video with this platform, but who could guarantee that people do not take picture or record your lecture or your presentation? This is very difficult, but because we are from the very highly appreciated country, Indonesia, and being Indonesian, and specifically being the family of Universitas Indonesia, and being the family of Cipto Mangunkusumo Hospital and other related hospital in the system of academic health system of Universitas Indonesia, I welcome you all, I invite you all to be applying the ethical conduct, all right? It's very tempting, you know, when you want to learn something that may be new or this kind of new information to you or give you different idea or different perspective, and this is very interesting slide, and then you just, in a snap point, you take your chance to get a snapshot, either with your computer or with your cell phone or with your camera. Very tempting because you would like to record. If you do really want to do it secretly like this, you have to still embark into the ethical conduct, and this is for only personal use for yourself. Once you share it, you cannot guarantee others to not to further share it, and then it may brings you into a problem with the ITE law in our country. So my last point, law and regulations may vary. Different countries embark into different understanding and system and different law and regulation. So because we live in Indonesia, just follow the rule. So be open to the existing, the current undang-undang about the ITE. I think that's my response to the important point that Irene has questioned. Okay, I think I have to stop because I have to make preparations for my next sessions. All right, so I thank you very much for all of you who has spent time with us here in this class. And I hope that all of you are always healthy and take your privilege at your best because you are appreciating yourself. I'll see you in the next chance. Take care.